The asbestos issue is not a thing of the past. It continues to this day.
We want to end this man-made disaster.
So let's ban asbestos.
I guess we will open this up for some questions from the audience. And right over here, do we have a microphone for you? Or?
I found the presentation, even though I've been involved with ADAO for a long time, I haven't been involved on the technical level quite as much. And I found the presentation regarding the AC pipes really scary. Wondering, is there any evidence that those pipes, asbestos can be leaked into the water, even if they're not disturbed during the kind of disruption that you described in Houston? So I guess I'm sort of addressing this question to both of you who addressed this during your presentations.
You know, I haven't seen the epidemiology looking at, you know, large populations that have had asbestos in their water. But the American Water Works Association, I don't know, quite a few decades back, put together like a handbook for municipal water systems that really described how the repairs of the pipes need to be done. And that is, you know, everything from the way it's cut with wet cutting or other tools, and a flushing of the pipes before it's put back online, and that water that is flushed out is actually treated like you know, hazardous waste. And so there are recommendations for how it's supposed to be done, and because it is water lines, presumably that's the reason that they've set up those standards. I don't have any information about how many cities follow those recommendations.
Well, we've run into that problem with some patients out of Seattle, where they have transite pipe for their water system also. But I don't, you know, in our understanding in Libby, you know, we're studying our water because the mine tailings ran into the river, and there's been an interest, as, you know, do we know anything about toxicity to biologic systems from the GI route drinking water, you know, and I don't think anybody knows anything about it. We're doing biologic studies with fish and other critters, and we're trying to look at that, but I don't know of any information out there on that. I assume they just have a protocol they think is safe and they proceed with it.
If I could interrupt, there have been studies on the health effects of water, and in 1992, I think it was, the EPA passed a MCL maximum contaminant level of 7.1 million fibers per liter, fibers being defined as those that are longer than 10 micrometers, and that was based on animal studies that showed that long fibers of amosite produced non-malignant tumors in the colon. The hazard posed by asbestos in the gut is much less than by inhalation, but certainly in a situation where you've got asbestos in pipes sitting out on a street corner, that's certainly a source. We did a study in 1982 where in Woodstock, New York, there were transite pipes that were collapsing, and I went out there and there were shower heads that were just full of chrysotile and crucidolite fibers, so much so that people standing in the shower just, you know, standing there with blue and white fibers on them. And we did a small study showing that indoors that the evaporation of water containing asbestos can be a source of low concentrations of airborne asbestos.
Brad, I just wanted to speak to that for a second. Back in the day, I hate that phrase, but back in the day when I was working with the Public Health Service, I chaired a committee of the that included the EPA and all the Public Health Service agencies to look at this issue of asbestos in drinking water. And as it goes through the gut, it's not really as serious a problem as it is when you inhale it. However, as Jim says, when it gets into the home, in showers and other places where the water is distributed, then it dries out and the fibers can become airborne. And really, we don't know how extensive a problem this is because we just don't have the epidemiological data to study this. The control populations are hard to find because everybody's exposed. So it's an unknown question, but we concluded our report by saying It is by no means safe. It may be, at our present knowledge, less hazardous, as Jim says, when it just goes through the gut as compared to residing in the lungs. But we do know that it can penetrate the gut. And we saw this in Minnesota, I think it was, and Duluth, Minnesota studies, and Phil Cook showed that. So this is something that needs more research, and by no means can you slap a good housekeeping seal on this way of using asbestos. And by the way, at one time, almost all of the cement pipe that delivered water in the southwestern United States was made from asbestos cement pipe. And it's falling apart now. And situations like in Houston are repeating themselves all over that part of the country.
I want to touch on one quick point when we talk about infrastructure and cement pipes and building materials, that we have a real problem in the United States because of the import and the housing and obviously lowercase infrastructures like subways and pipes that we're seeing, and Heather, we use this when we talk to staffers as you do, is that we're seeing with Hurricane Sandy, 9/11, that what Celeste described to you as a one-off with these two very brave workers is actually very common. We hear a lot about it. They ask for ADAO's help. We write letters to OSHA. It is a very complicated and common problem that is not addressed properly by our government, although we try to take the right political angle. So TSCA reform, Heather, through your leadership is going to be important, but we still need to step up reducing hazardous debris exposure, another area that really needs to be studied in my humble opinion. Question, Ms. Ann.
Quick question for Heather, and actually just on that point too, I think in any regulations, when your story about that they were basically blackballed after talking about safety, it's important to have the retaliation provisions in any of our standards, which I think we have to really fight for. But Heather, you were talking about a lot of your research was up into 2001, and wondering if you're updating your research so that we could actually carry that forward as well when we're talking to our legislators, and maybe update us on that.
Yes, it's just really a question of resources. So we haven't been able to update the map based on the master death file. It's something that we're definitely interested in and happy to share. Linda, we can share that information with you and how we did that analysis. It was very compelling. That was during, if you recall, the National Asbestos Trust litigation trust proposals that were out there. We were really part of that campaign just to make sure that that didn't happen because of all the concerns we had about basically people not getting the justice that they deserved through kind of forms as opposed to an actual litigation. So we worked really strongly with the, or had a great relationship with the Association for Justice, which has been really helpful. And basically we used that map and went district by district and were able to really tell those stories. But we would love to update it. We just haven't been able to because of resources. That's it. Yeah.
We have time for one more question. And if not, good news, there's a, Just a
quick question. This is probably for doctors, for Brad and Jim. And Heather, you talked about the deniers and the obfuscation. So I'm working on proposed mine in Minnesota. The company's saying, oh, they're cleavage fragments, they're too small. That was one thing that you really didn't touch on. Jim, maybe you could just speak to that. What are cleavage fragments? Are they dangerous?
Well, cleavage fragment is a term that's convenient for the defendants. Because they're trying to tie into the regulated asbestos, and they bring in their geologists who say, well, it has to be, you have to see the split ends, and they have a number of characteristics that you just don't see in a fiber that's inhaled into the lung, because those big fibers don't get into the lung. It's the very short fibers that get in there. And it's also the any fiber that is smaller than 0.5 micrometer in diameter is going to get in there. And the evidence that we have is compelling that if it is that narrow and that long, that is going to cause interactions in the lungs. And Phil Cook, who just recently passed away, and Chris alluded to, he's been doing a lot of work on it. And your lungs don't really care how you define it. It's how it works within the lungs.
Well, we have to take a break now. But before we do, Linda asked me to walk up and show you something. This is available on ADAO's website, and this is an infographic, if that's the right word, that we put together. Hopefully there's no mistakes. We've gone through it pretty detailed, but it's available on our website and you can print it out. And it's addressed asbestos legal and lethal in the U.S. And it has a lot of different facts about what you've been hearing today from speakers, and we'll continue to hear the rest of the afternoon. But we suggest you visit our website and download this. It's quite a bit of information on a small piece of, well, a long piece of paper. So take your afternoon break. Please be back here at 3:10. And you can look at this in the back of the room.